Hello and welcome to your OB course. Today we're going to be talking about maternal, paternal, and family adaptations in general that occur during a pregnancy and with motherhood. Some of the things we're going to be addressing in maternal adaptation is safety, the social acceptance of the pregnancy, maternal fetal attachment, giving of self to motherhood, loss of self and self control during pregnancy and motherhood, acceptance of the pregnancy, ambivalent feelings. This is an important topic. Identification with a new role as a mom, and the relationship to their mother, the pregnant woman has with her mother. And then, of course, the preparation for labor. So, we're going to talk about a couple of those things. So, the news of being pregnant can cause a lot of emotions in a woman, no matter how desired a pregnancy is. Okay, for some women, this news could be fantastic and it could be everything that they wanted. And for other women, it might be detrimental. Maybe they are in an abusive relationship. Maybe they didn't want the pregnancy. So a lot, it stirs up, it confers profound and irrevocable changes in a woman's life. So it's important. We do know of women whom all they've ever wanted to do is be pregnant. And when they get pregnant, they become very fearful. They're scared. So we're going to talk about that, right? So there are what we call maternal tasks of pregnancies. Maternal tasks of pregnancies were basically explored by different researchers. The latest one was explored and outlined by classic maternity research by Reva Rubin, Ramona Mercer, and Regina Letterman. Okay, so this research basically provided a framework, okay, and a knowledge base for researchers and clinicians and identified the significant maternal tasks that women undergo during the course of pregnancy. One of them is, when we talk about safety, is ensuring a safe passage, not only for herself, but also for her child, okay? The mother's knowledge and care seeking behaviors to ensure that she and the newborn emerge from the pregnancy healthy. So women become concerned. They want to protect themselves. They want to make sure that they remain safe, and they want to make sure that the baby remains safe while they're pregnant. Okay, I, as an L&D nurse, have had many women who come in and they say, oh, I tripped over my house and I fell. Did you fall on your abdomen? No, but I'm scared, that something may have happened to the baby. I want to make sure that everything's okay with the baby. This is normal behavior. Okay, and when we talk about social acceptance, it's referring to the acceptance of the child by the significant others. All right. Why do I say others? Because it's not just that partner that they're with, but also their family. Okay. A teenage girl, for example, who becomes pregnant at 15, her significant other, who's probably also 15, may be thrilled with the idea, probably because they don't know any better. But her mother, her father, maybe her friends are not. Okay. So this is the social acceptance that we are referring to. Then, of course, we talk about maternal fetal attachment. What is maternal fetal attachment? It is the bond that occurs, or the binding that occurs between the mother and the developing fetus. Okay, so there's a lot of things that can affect that. And it is important that this occurs throughout the pregnancy so that when she has the baby, she can transition into her role with ease. Okay, then we have what we call giving of oneself to motherhood, and basically refers to having to sacrifice a lot of who you are and what you do and what you like to do for the demands of motherhood. Okay, you have to be willing to put forth the effort and make sacrifices for the child. This is very hard, again, particularly in adolescent pregnancies when they want to go out, they want to hang out with their friends, and they no longer can do that because they have a child to care for. All right, so then they have to go through the task of accepting their pregnancy. Okay, this might seem a little odd. Like, how do you accept your pregnancy? Well, they have to accept it and say, okay, I'm going to do this. And we expect them to have different situations, okay? There's different changes that are going to be occurring as it relates to the growth and development, all right? So they have to be responding to mood changes. They will experience ambivalent feelings, which we'll talk about in a second. They also will have to be dealing with nausea, fatigue, other physical discomforts of pregnancy, financial concerns, right? This is another person that they're now going to be responsible for. Increased dependency, okay? If, again, I like to give the example of a teenage mom. She now is not only having to deal with the fact that her parents have to support her, they also have to support her child, all right? So it's a lot of things that are going on, okay, when it comes to that. So let's talk about ambivalent feelings towards pregnancy. And this is really important that you guys understand. Basically, what happens with ambivalent feelings is, I'll go back to a woman who's maybe 35 years old, who's undergone in vitro, and now she finds out she's pregnant, and she's excited for at first, and then she finds herself being afraid and wondering, oh wow, I'm really pregnant. Is this what I want? And they start having feelings of ambivalence. They're no longer sure, So then this one thing that they've always wanted and that they thought was everything and was going to make them happy and that they've pursued and they've done in vitro and all kinds of infertility treatments and all, now she's pregnant. Now she has what she's been looking for, and she becomes concerned, okay? A lot of women feel guilty that they feel this way. What do we need to tell them? It is normal. These ambivalent feelings are normal during the first trimester. Important to know that. First trimester. If a woman has ambivalent feelings, by the third trimester, we have bigger issues and they have to be addressed. But even in the first trimester, when women express this, you have to let them know that it is normal, that it is a process of accepting the pregnancy. Okay, that this is going to happen. And that as the pregnancy progresses, these feelings are expected to decrease. Even so, during the first trimester, it's important that we identify, what is it that is causing these ambivalent feelings, all right? So we have to evaluate the ambivalence and we have to assess the reasons for the ambivalence and the intensity. There are women who are very, very, these feelings are very, very strong, and they're like, no, I really, really don't know that I want this pregnancy anymore. Forget what was happening before she got pregnant. Now that she's pregnant, she's like, wait a minute, I don't think I really want to do this. I don't want to play anymore. So we have to address all of these things, but please understand that you need to educate them that they do not have to feel guilty, that this is normal. Now, like I said, if you have a patient who's 7 months pregnant, she comes to you and she's telling you she's not sure she wants to be pregnant, we have bigger problems and we might have to refer them out to somebody who can help them, a therapist or something, okay? The other thing we're going to talk about is identification with the new role. What is the identification? It's basically the woman's acceptance of pregnancy, okay, and the relationship she has with her own mother, all right? And there are different things that can facilitate attachment and transitioning to motherhood, to the motherhood role, or accepting this role, all right? If a woman hears her fetal heartbeat, that makes it real. I myself remember when I got pregnant, I had been married for 6 years. In fact, I thought I couldn't have children. And when I found out that I was pregnant, it was surreal. And then I went to the OBGYN and I heard my baby's heartbeat for the first time. And not being an emotional person at that moment, I remember crying and being just overwhelmed with, emotion. So anyway, these are things that help attach to the baby, to the child, because it makes it real. Okay. Women start anticipating the changes that motherhood is going to bring to their life. They seek the company of other pregnant women because they feel, okay, this person will understand me. In a way, it's kind of like they build their own little support group because they're going through all these changes in their lives and they can share those with other women who are pregnant. Okay, so they will seek the company of other pregnant women. If a mom is highly motivated to assume this role, chances are that they are going to attach easier to the baby. It's also important a lot of times that they see the fetus move during an ultrasound examination, when they start feeling the baby's kicks, that's important. Um, and again, when this is occurring as it should, you're going to see the mom starts to participate in the role, and she's engaged and she loves going shopping for her baby, etc. Now, going back to the relationship to her mother, all right, if a woman has unresolved mother daughter conflicts, okay, these can reemerge during pregnancy. All right, so it's important that the woman understands that they're honest with themselves and that they recognize that they do have issues to resolve with their own mom. All right, four components that are important to the woman's relationship with her own mother are the availability of the woman's mother to her in the past and in the present. So, was their mother there when they were growing up? Did they feel like they had a mother who was present? And is the mother present now? Okay, if a woman had a mom who maybe was a drug user and she was never there, she maybe has feelings of, abandonment. These are things that affect her in her role as a mother. What are her mom's reactions to her daughter's pregnancy? Is the woman 14, 15? Is it a 30-year-old woman? What's going on there? And there's a lot of scenarios and things that can happen because obviously the response of the woman's mom will vary on the situation. And of course, the relationship with their daughter. The mother's willingness to reminisce with her daughter about their own childbirth and child rearing experiences. So these are all things. A lot of emotions are occurring during pregnancy, and women are, taking time to think and analyze everything that has transpired in their lives as it relates to their own mothers, their fears of maybe, everybody wants to be the perfect mom, and they may be scared that they won't be able to. Nobody will, ever will. Children don't come with an instruction manual. And then we also see a lot of women who are maybe a little anxious about the labor process. It's important that we educate them on preparing themselves, for this process. Preparation for labor and birth can occur through taking classes, reading, daydreaming even about the labor process. All right. The degree of preparation for labor and birth affects the woman's level of anxiety and fear. So the more prepared, the better prepared that she is or feels, the lower her anxiety and fear will be. This is why prenatal education is crucial. This has to occur, obviously, at the obstetrician's office. The woman herself has to seek the knowledge. And if possible, there's a lot of hospitals in the community that offer classes on parenting, on the labor process itself, on breastfeeding. A ton of information is available for women if they want it. Okay, so what are some of the expected findings? We want the woman to attend childbirthing classes, to be reading books, using their smartphone and different applications to track their pregnancy and fetal movement. With the women should be mentally rehearsing or fantasizing about the labor and birthing process, how they view it in their minds, and what would be the ideal process or progression, better yet, of their labor. The woman has dreams about labor and birth. She works with her partner on birthing and coaching. Okay, so she wants to make sure that her significant other is educated as to the labor process. All right, and then very important that we know and that we teach them that they can develop a birthing plan, but that they must have realistic expectations. Okay, they have to know that while you can have, a plan from A through Z, things might change. Labor is very dynamic. We don't know how the child is going to respond to the process. And so they must be realistic and flexible when preparing a birthing plan. And I put this quote here from Joe Churchill. It says, the most important thing she'd learned over the years was that there was no way to be a perfect mother and a million ways to be a great one. And this is very, very true. There are also other factors that affect maternal adaptation. These are age, sexual preference, single parenting, multi-gestation, socioeconomic status, military, and abuse, of course. So, with maternal age, I've been giving the example about adolescence. There are different stages in adolescence. You can be in early adolescence, middle adolescence, and the age range is different. So early adolescence refers to ages 11 to 13. Middle adolescence refers to the period between age 14 and 18 years of age. Please note, pregnancies at this age do happen. I did have less than a year ago a patient who was 11 years old and she was having her first child. I remember that at 11 years old, I was playing outside with my friends. I was hanging out, playing with, toys and dolls, definitely not thinking about being sexually active or much less being pregnant and having a child. So as you can see, this is something that could be very, very, very difficult, not only for the child but for everybody around her. Okay, so with these type of patients, it's important that they understand and that they receive that there are comprehensive and community-based healthcare programs, all right, that will improve the outcomes for both the teenage mom and her infant. Some of them are programs that have been implemented in the schools that they attend, community clinics, community agencies. There are some that even offer home visitation programs. Okay, a lot of them are embarrassed to go to the doctor's office because they look like children, and here they are pregnant. So they have nurses that visit them at home. They do need higher levels of support. Okay, and the goal is that these higher levels of support will result in higher self-esteem and a more positive adaptation to the role of motherhood, particularly for adolescents. Okay, then we have the other end of the spectrum, which is older moms. Older mothers are better equipped psychologically to assume the role of a mom. However, they have other fears, okay? Because even with excellent prenatal care, there's an increased incidence of adverse perinatal outcomes, all right? We have chronic diseases that are more common after the age of 35. Older moms are also more likely to have miscarriages, fetal chromosomal abnormalities, low birth weight infants, premature births, and even multiple births. And we're talking about women who are older than 35. When it comes to women who are older than 40, the risk for placenta previa, placenta abruption, cesarean deliveries, preeclampsia, and gestational diabetes is much greater. Okay, so these are some of the things we're going to talk in other sessions. What is a previa? What is an abruption? What is what exactly is a cesarean delivery, preeclampsia, and gestational diabetes? So we'll discuss that later. But it's important that these are some concerns with women that are older and get pregnant when they're older. Sexual preferences. One of the biggest things is that, for example, lesbian mothers are more likely to lack social support. This is important, to address. Finding supportive healthcare providers with whom they're comfortable disclosing their sexual orientation is important, and it needs to be identified by the lesbian women. Lesbian moms are most commonly plan their pregnancies and conceive through donor insemination. So this is another layer of complexity for these women. Okay. Women nurses who are assessing lesbian mothers have to adapt their assessments accordingly. You need to strive towards using inclusive language and avoid making assumptions about the woman's gender orientation without further information. Then we have what we call single parenting. We see this a lot. We live in an era where fatherlessness is a big issue. Generally, single moms live at or below the poverty level, and they face greater financial challenges and ultimately result in depression. So there's a lot of things that can come from that. Okay, some single moms are financially stable and have well-established careers, but that is not the common finding. So it's important that we are aware of that. Then, of course, we have multiple gestations. Imagine you want a baby and all of a sudden you find out you're having triplets. It places added psychosocial stressors on the family unit. Maybe you were mentally, emotionally, and financially prepared to have a baby, but not three, okay? Because now you're thinking, oh, wow, I have to pay for daycare for three newborns. How much is that going to cost me? And does it make sense for me to go back to work? And if I don't work, I'm going now from two incomes to one. So this adds a lot of stress. So for the couple, in many, many ways, not just financially. So it's important that we address that. Speaking of financially, socioeconomic factors. What are the financial barriers? Okay, have they been identified? This is one of the most important factors that contribute to the maternal inability to receive adequate prenatal care. I live in South Florida. We have a lot of women who don't even have health insurance. You know, we know that the government provides or facilitates health care, but a lot of them don't even have maybe the $30 or $20 that it requires to go see an obstetrician to get evaluated. Okay. Um, if they're homeless, okay, obviously that plays a vital role in the accessibility of healthcare and the consistency of attending scheduled appointments and maintaining proper prenatal care. We also see these issues with immigrant women who face significant economic barriers. Okay, these women are generally marginalized, have work in low income service oriented jobs, so access to healthcare for these women is very, very limited. The elimination of these healthcare disparities that results from low income has already been noted. It was noted by Healthy People 2020, and I am sure will continue to be noted by Healthy People 2030. Then we have military. What about the military? What if you're pregnant and you get deployed or your significant other gets deployed? Okay, military life has a lot of challenges and obstacles. And if your husband gets deployed, you are left alone and you basically become a single parent while they're gone. You might be living in an area where you're surrounded by your family, and then you have to move with your significant other. They get relocated, so you have separation from family. So all of these events are definitely stressors that mothers to be have to deal with when they are in a military family. And then we have, of course, abuse. If a woman is in an abusive relationship, which by the way, pregnant women are more likely to be involved in intimate partner violence than other women. This, of course, adds a lot of stress to the pregnancy and can, in fact, alter the outcomes. Okay, I've sadly seen cases where a woman was the victim of physical abuse and miscarried as a result of that. So these things do happen. And we're going to talk about paternal adaptation. So, what we want to know is that um, the culture and the attitudes have changed towards the participation of the parent, the father, the paternal participation in the birthing experience. However, we must remain cognizant that culture plays a key role when it comes to this. Okay, in some cultures, pregnancy and childbirth are viewed as exclusively a woman's domain. Okay, so the fathers are very absent from this entire process and they are just viewed as the provider. Here, you facilitate the means for me to be able to take care of the children. They really don't get involved. Okay, now, um, again, there is an increased emphasis on his role as a provider, and it causes a lot of men to reevaluate their lifestyle, their job, their career. A lot of them have to get second jobs, etc. With the focus of prenatal care on the woman, the growing fetus, the man struggles a lot of times with feeling like they're even relevant, like they're even important when it comes to the pregnancy. Fun fact, many men experience what we call Kuvad syndrome or a sympathetic pregnancy. And they basically begin to experience pregnancy like symptoms. A lot of them get nauseous. They start gaining weight. They start having even abdominal pains like Braxton Hicks. This is real, okay? They may experience this. So it's important that you comfort the male in knowing that it's going to go away, that they're not going to be like that forever. All right. Um, the other thing that I want you guys to understand is the paternal adaptation to pregnancy has different phases. It has the announcement phase, the moratorium phase, and the focusing phase. So, what do we see here? In the announcement phase, they may react to the news with a lot of joy, distress, or a combination of emotions. All right, depends on whether the pregnancy was wanted or not planned. All right. Then we have a moratorium phase, which that name, it sounds really scary. But during this phase, basically, men are thinking about the pregnancy, but they, for a moment, set it aside. And as their partners are undergoing dramatic physical and emotional changes right before their eyes, they kind of, you know, are grieving, I guess, the process. And this can cause a conflict when the women are attempting to communicate with them. And they're like, no, I don't understand what you're talking about. So, this is one of the phases. And then we have the focusing phase. This begins already in the last trimester, and they start to become actively involved in the pregnancy and the relationship with the child. This is when they start feeling, they want to feel the woman's abdomen and feel the baby kick, etc. And they start thinking about them becoming fathers. Okay, they participate more actively, they want to be, they become interested in coaching during the labor. And they start to negotiate with their partner the role that they're going to play in the labor and delivery process and the preparation for parenthood. The other thing that's important that we understand is sexuality in pregnancy. Okay, when you get pregnant, it doesn't mean it's the end of the world and you can no longer be sexually active. This is incorrect. Okay, please note the desire for sexual activity varies among women, among pregnant women. So, sexual desire can be the same, and but it'll vary throughout the different phases of pregnancy. All right. The woman's interest may decline the first trimester because they're trying to assimilate the pregnancy itself. And in the second and third trimester, we see a variety of patterns. All right. So, the desire actually in the second trimester may be increased because of increased the sense of well-being of the due to the pelvic congestion associated with the pregnancy. So basically, there's a lot more blood flowing in the pelvic area, so it might increase libido. The bottom line is that you want to make sure that your patient understands that it is okay to be sexually active. Now, there are women who go on pelvic rest. They cannot have sexual intercourse because it stimulates contractions, but those are the exception. If that's not happening to them, there is no reason why they cannot, engage in coitus. And we're going to talk briefly about the support system, which is not just your significant other, it's the grandma, the sister, the cousin, the neighbor. Okay. In your support system, we have to understand there's different types of family configurations. We talked about the single parent. We now see a lot of three generational families sharing, cohabitating. They all live in the same house. You have grandparents, the children, and the children's children. Okay, so these are things that affect the dynamics of um, the house. We also have the grandparents that we have to be concerned with. And very important, sibling adaptation and sibling rivalry. Okay, sibling adaptation is greatly influenced by the child's age and the developmental age that they are, the level that they have, and of course the attitude of the parents. Okay, children that are younger than 2, they're usually unaware of the pregnancy and don't understand any of the explanations when it comes to the new baby. But when they're, 2 to 4, they will respond to the changes, the obvious changes, obviously, of the gravid uterus is, as it evolves, the mom's body changes and they will notice it. Therefore, the parents have to make sure that they explain to those children what's going on. They also have to teach them that things are going to change, that a new baby is coming. We want to associate them, with other babies so that they learn what that is and what it means. Okay, children that are ages 4 to 5 usually enjoy listening to the fetal heartbeat and may show interest in the developing fetus. So you want to maybe take them to your doctor's office and listen to the baby's heartbeat and be able to visualize the fetus in an ultrasound machine, okay? School-age children are usually enthusiastic and interested in the pregnancy, okay? Um, they often like plan this whole like elaborate welcoming parties for the newborn, and they want to be able to participate, and they're excited about their new, baby. That is not the case when you have adolescent children. They might be embarrassed that their mom is pregnant and they're maybe 18 years old. So it's they'll act indifferent, like they don't care, but parents have to be, pay attention to these children as well. You as a nurse, it's important that you discuss strategies to facilitate sibling adaptation, and this has to be done based on the child's age. Other factors that can affect pregnancy and how pregnancy is perceived, of course, are mental health issues. Please note that 1 in 17 women suffer from severe and persistent mental illness, or SPMIs, okay? And basically this refers to a complex mood disorders that include major depressive disorder, psychosis, severe anxiety, bipolar disorder, schizophrenia, etc. All right, it's important that nurses are aware of the different community mental health resources that are available, and that nurses are prepared to collaborate with, the psychiatrist, the mental health specialist, social services, and community agencies, because mental health issues during pregnancies can create serious problems for women across several dimensions. So we have to know that this is real, that patients with mental health issues do get pregnant, and that a lot of them, because a lot of these drugs that they take to, control their condition are teratogenic, have to come off medications. So it's important that we know that there are resources and that we learn to deal with these patients. Adaptation complications, things that can occur that limit a woman's ability to adapt to the pregnancy, okay? And they depend a lot on the condition of the pregnancy, the perceived threat to the mother or fetus, coping skills, available support, um, things of that nature. The risk of a crisis for a pregnant woman and her family increase due to an unpredictable or uncertain pregnancy outcome. Right? For example, if a woman is told that she's having a child with Down syndrome, maybe she's not prepared for that, and this will definitely affect the adaptation process. And then, of course, social support. It is important that the woman feels like she has the support of her significant other, of her partner, her mother, and her close friends. All right, involvement of such support and having the presence of the significant other during this process improves maternal mental health, and it contributes to less distressed infant temperament. Okay, so it's important that we understand these things. And Frederick Douglass said, it is easier to build strong children than repair broken men. So this basically refers to the importance of proper parenting, and all of that begins with the proper adaptation to pregnancy and the role of parenting. So I hope you enjoyed this, and again, that it spiked your curiosity so that you can go back and do more reading and more research. See you next time.